Okay, I think we will get started. Hi, thank you all for joining us for a Center on American Politics discussion on health policy and American politics. This is the second chat between me and my esteemed brother, Dr. Harris Masket. We're glad you're on here to ask us questions today. I want to briefly mention a few things. The Center on American Politics here at the University of Denver is putting together a pretty ambitious calendar for the fall. Leading up until Election Day. We're going to have a discussion on conspiracy theories in American politics on September the 16th. We're going to have a look back on a summer of Black Lives Matter activism and protest on October 1st. We'll be helping with the debate between US Senate candidates from Colorado, Cory Gardner and John Hickenlooper sometime in October, and lots more. We'll be sending out information about all this, so please watch for that. But for today's discussion, I'd like to do some quick introductions. My name is Seth Masket. I am a political scientist here at the University of Denver. My co-conspirator here today is my brother Harris Masket. He is the Chief Urgent Care Physician at University Health Services at the University of California at Berkeley. Go Bears. In addition, he has been doing a series of bi-weekly talks, online talks at the Bay Area Disc Association to teach people about the epidemiology of the COVID virus. You can find those talks on the Facebook page of the Bay Area Disc Association. They're really good. Okay, here's how this works today. I am going to ask him a question about medicine. He's going to ask me a question about politics. And then basically we're going to turn things over to you. If you have a question about healthcare or the politics of this whole pandemic era, please feel free to type it in using the Q&A button that's at the bottom of your Zoom screen. And we will do our best to answer as many of your questions as we can over the course of the next hour. To help us with this, we have invited Maddie Alder. Maddie is a recent graduate of the University of Denver's political science program. She is now an AmeriCorps teacher with City Year here in Denver. And she will be helping to manage all these questions and to steer them our way and to make sure one of us isn't taking too much of your time. Maddie, thank you in advance for doing this. Also, if you're interested, there is a chat button at the bottom of the screen. If you would like to chat with each other, if you would like to identify yourself by name and where you're writing from, we'd love to encourage that. But again, if you want to ask us a question, please use the Q&A button at the bottom of your Zoom screen. Okay. Harris, if it's okay with you, I have my first question ready to go for you.
Go for it.
Okay. So basically, over the last month or two, we have seen COVID infection rates and deaths really ratchet up over the past, in recent weeks, mostly in the Sun Belt states, places like Florida, Texas, Arizona, Southern California. Presumably because it's summer, lots of people are working indoors with air conditioning. I guess my questions for you is that a correct assumption? And if that is, what should we be expecting from the fall? Will we be seeing COVID rates dropping in those states, but increasing up in the northern states as people start using their heaters in their office buildings? Or is this virus just proving too hard to model and to predict?
Well, that's a great question, and that's a lot of questions. So I'll try to parse it out a little bit. One of the interesting things about the virus seems to be the way it spreads, and unfortunately, it spreads more like you're kind of alluding to this in your question. It spreads more when we're indoors. It lasts longer indoors. It floats around us more indoors. So unfortunately, as we move indoors, for whatever the reason, whether it's because it's too hot outside and we all move to air conditioning, or it's too cold outside and we moved inside that way, that will be more of a risk for spreading this. There's another factor, which is humidity and air conditioning devices. Basically, a wetter air or a more humid air is going to make these little viral particles wet and heavy, and they fall faster, for lack of a less scientific description. So if you're in air conditioning where it's a little more dry, that's going to float around inside a building a little bit more than if you're in a very humid environment. So I live in an area that's very temperate. I don't have air conditioning in my house, which is rare for this country. So that's not going to be an issue in some places, but in places where it's heavily air conditioned, those places are going to have a little bit more of a problem with indoor locations. places that are using heaters, as long as it's basically drying out the air, those particles, you can think of them drying out and floating in the air a little bit longer indoors. So there's another piece to this, which is, is this an illness that changes with the seasons? Like, we're used to a cold virus, like a coronavirus, it comes from cold viruses, or at least we are typically infected by colds from coronaviruses. Those tend to afflict us more in the winter or the early spring. And that doesn't seem to be the case with this coronavirus. It seems like we're going to be with this no matter what time of year. But more humid environments, let's just imagine we're outdoors for a second. If it's a more humid situation, it's going to fall to the ground a little bit faster. So I hope I answered that a little bit.
Thanks. Yeah, that's a lot.
I've got mine for you, but I guess one of the biggest things that I've been kind of noticing about this pandemic so far, physicians are always used to that the most difficult thing, and I'm a patient too, so I can understand both sides of this discussion. One of the most difficult things about healthcare is that we have recommendations for our patients that aren't necessarily fun to do, like like limiting risk and eating well and exercising, all those things that, we come up with all of these different ways to engage ourselves in doing healthy behaviors. That's just, from the little pill box that goes Monday through Sunday, all the way to motivational interviewing, ways to help us stop smoking, all those different kinds of things. And we're all used to this because, like I said, I'm a patient too. But one of the things that I'm always used to is that I'm going to have a little hurdle in getting my patients interested in the things I'm recommending. I have never been in a situation before where the hurdle is actually the elected officials in my area. And so this is obviously where this becomes a political discussion. I've never seen a situation where I make a recommendation, or healthcare makes a recommendation like wear masks, and the elected officials actually directly contradict that situation. So skipping to the question for you, Seth, what will be the pandemic effect on the upcoming election?
Wow. Okay. So yeah, there's a lot packed in there. It seemed like you're steering toward why are elected officials acting this way? That's a harder one. But
we'll get to that. We'll get
to that. Okay. But if the question is sort of like, what is the overall pandemic effect on this election? It's an interesting question. So one of the things is that we don't have a whole lot of previous cases to look at. There haven't been that many, particularly presidential elections, but there haven't been that many major national elections during a massive outbreak of a disease. Probably the last one would be 1918 during the Spanish flu, which was ripping through the country. It was definitely a big event. It was definitely affecting and killing a lot of people. There have been a few studies done of how that may have affected the congressional midterms of 1918. It doesn't look like it had that big a political effect as far as we can tell. Now, you have other things going on. You have World War I going on as well. There's a lot of moving parts in that election. But there doesn't seem to be a whole lot of an impact from the flu itself. Now, there was also, at that time, there was much less of an expectation that it was the federal government's job to deal with a pandemic. Since the New Deal and a lot of other developments over the course of the 20th century, basically, when there's a disaster, we look to the federal government for help now. And presidents are much more evaluated on those terms now. If you think about presidential elections, generally speaking, when there is an incumbent in the White House trying to defend his seat, those elections tend to be basically a referendum on the president. That is, they focus on an evaluation of how well the president is doing at the job and on the issues that voters seem to care about. Voters really care about this virus. Voters are paying a lot of attention to it. This is not like some second or third tier issue. And at least according to public opinion polls, they're not evaluating him very highly right now. He got an initial bump like a lot of national leaders did, a lot of governors did when the virus first broke. Sort of a rally, considered kind of a rally around the flag effect. When there's a crisis, people rally around their president. But that only lasted a few weeks. And since then, polling evaluating, how well he's handled the virus has dropped a lot for Donald Trump. And people are just generally not very positively inclined toward how he's been handling this crisis. You also have, it's kind of hard to separate out evaluations of the virus with evaluations of the economy. Those have both moved pretty similarly for obvious reasons. The economy is also in a pretty bad situation right now. You have unemployment really as high as it's been any time since the Great Depression. And again, that's something that people really do vote on. If the economy is doing poorly, they blame the incumbent president, fairly or unfairly. So, all these things are hurting Donald Trump. They are hurting other Republicans simply because they share the president's party affiliation. How much is difficult to say. If you were to look at polling in the presidential race back in January, back in February, they showed, and again, it's not a perfect comparison because who the Democratic nominee was not really known at that point, but there were matchup polls we have between Trump and Joe Biden at that time that showed Trump trailing by about 4 or 5 points. Okay, he is now trailing by around 8. So maybe that might be a measure of the effect. And he, given how he tends to run, he was also trailing Hillary Clinton by a little bit in 2016. He ends up pulling an electoral college victory. He might have been on track for a similar style victory this year. Incumbent presidents tend to win. He might have gotten a narrow re-election victory like George W. Bush in 2004, like Obama in 2012. The virus and the damaged economy as a result of the virus, these are hurting him pretty substantially. And so I think that is your effect. And that could mean, that could end up changing the outcome of the presidential election. That could end up changing the outcome of who controls the US Senate. It will probably change who controls a number of state legislatures as a result of this. Which direction, again, we still have like 3 months until the election. You could see things going either way, depending on how the virus plays out. If the pandemic gets worse, which it certainly could, that probably hurts him more. If things simmer down, this could become a more competitive race. But right now, yeah, you're seeing a virus effect.
Well, and that's an interesting piece because I would expect, just like we've noticed, and there's some good modeling on this, that basically when you start following the non-pharmaceutical interventions, the distancing, the mask wearing, the cases go down. So this whole country is sort of in the grips of this right now, and you expect that maybe it takes a little while for people to change their behaviors, but there will be some change. Maybe in September, we have a decrease in numbers. Maybe in October, it's even better. Maybe the election is not as affected by this. It's hard to imagine that, but I think one of the, you're my brother, so I've read your stuff before. One of the things I've always noticed is that you've documented well that the electorate doesn't tend to remember for that many months. I'm wondering if this is a different situation, do you think? How long do you remember a pandemic? One of the things I read interestingly about the one from 100 years ago, and maybe it was that it was a flu and it sort of just ends all of a sudden, but people didn't seem to remember it. At least this one historian said people just moved on. They were like, okay, that's over. Do you expect the electorate to remember this if we have a good September, October?
That's a great question. And again, we don't have that much to compare it to. But, people feel the effects of, even if caseloads start decreasing a lot of people will still be feeling the effect of this virus, for several months at least. Obviously, if there's deaths in their own family, they'll still be experiencing that. If they're still sick themselves, if their job still doesn't exist, or they're still furloughed, or their hours are reduced, or they're having to, just deal with a lot of financial difficulties as a result of it, even if caseloads are looking better. My expectation is there's still going to be significant effects of this virus on the election. But yeah, you're right. People tend to vote with on a pretty short-term basis. Things that happened 3, 4, 5, 6 months ago just don't weigh as heavily. I'd be shocked if things could turn around that quickly, though. To a point where like the economy is booming again and everyone can go out and have drinks and go to restaurants and everyone can go to work and all the kids are in school and everyone's fine and comfortable with it. I'd be pretty shocked, honestly, if we'd be there by, say, October.
So would I.
Okay, good, good to know.
And I also, and you know, I do expect the weather, you know, not that I'm a weatherman, I'm a doctor, Jim, but I do expect the weather to improve. It improves in our country in general. September's lovely. October is reasonably nice as well. So if the weather is good, do people go outside more? Or does the virus spread less? I don't know. And we also don't know how people are going to respond to events that people normally like to have in September and October. Does the NFL happen? Do people gather for those games? That kind of situation. I mean, super spreader events are still probably going to be the most important thing, but I expect the real problem, like you talked about at the beginning with the weather, will be November, December, people are indoors. And also the big question mark all across the country is schools. Mm-hmm. Will they be open? Will that be an event that causes a lot more infections or not? It seems like that won't, but it could, so.
Yeah, that's a big one.
Speaking of schools, we actually had a question on that. So Harris, could you comment a little bit on the schools in Georgia and other places that have already opened, teachers being put in quarantine, et cetera, stuff like that? Do you think we're putting our kids at risk by putting them in these indoor environments where there's not a lot of ventilation and lack of social distancing?
Thanks, Maddie. That is a great question. So whoever posted that, I think we're all thinking about that. I have 2 children. I'm thinking about that every day. I also work at a university, and a lot of our work this entire summer has been focused on safely bringing students back to UC Berkeley so that they can go to school in a safe way. So my comment is that this is doable, you know, and a great example of how this is doable is if you are paying attention to the women's NBA or the NBA, how they have wonderfully conducted a safe re-entry. They've created this bubble, right? And so we all can imagine a bubble that works really well. We've got some technology, and clearly the NBAs are proving that. But they have a lot of money and they have a lot of buy-in, and it's really challenging to get a large group of people to do this. So the short answer is this is doable. The more complicated, nuanced answer is it's doable, but there are a lot of other issues that already afflict our schools. There are a lot of resource issues, and I don't know that each of these public school systems have really gotten the resources and support to do exactly what we need them to do. So I'd say that, you know, personally, it's frustrating because, you know, I spend every day working on this. I know that it's doable. Each of these school systems could do it had they been given the resources and time, but that's just not quite feasible. And so we are looking at a situation where teachers and students will be put in a situation in a pandemic where they will be exposed potentially to a higher risk of infection. How much higher? Not much, but enough. Now, there's another piece to this, which is that everyone keeps hearing about it, that younger people don't tend to get this infection in the same amount, you know, like they don't get as sick. They don't tend to spread it to each other as often. And they don't tend to have the same mortality. They don't tend to be as poorly affected. That doesn't mean that their teachers wouldn't be, because their teachers are older. And there are a lot of statistics about this. Basically, it seems like the younger you are, the less likely you are to get the infection and spread it to others, like boiling it down to a nutshell. But that doesn't mean that holds as true for middle school. And it definitely doesn't seem to hold as true for high school and college ages. There are some terrific examples from other countries. Australia just released a study, and so did Europe has released tons. There are basically other school districts that have done this, and in general, they've shown not a high rate of infection and not a high rate of spread, not only within the home then, but to the teachers and to their families. So it looks doable, but like anybody can tell you, there are resource issues in our school systems. Seth, any feelings on that? You have children as well.
I have children. I work at a university. I don't know. They're just, a lot of concerns. I guess it's sort of a related question, is that like, we're starting to see plans roll out for different schools. And some schools are just saying, look, we're completely online for the fall. And here's our plan for doing that. And other schools are, really, attempting some sort of combination and to do in-person learning where it's feasible. And have you seen sort of a model school in this sort of thing? Or is there a model school approach or a model district somewhere in the country that you think is really kind of nailing this?
No. The short answer is I haven't found the model district. I mean, most of our schools are not open, obviously. Now we're just getting into the opening stages. But there are some really terrific models of how this has been done in Europe, because they've been opened some of the schools have been open throughout, like since May and June. So there are some statistics on that. France has already published a lot of their data. Basically, the students don't seem to bring an infection in from, they bring it from their family or something and spread it to other students as well as the rest of the population. And in addition to that, they don't seem to, if they get an infection, they don't seem to spread it to their families as much. So that's a big piece, is that even if the infection does hit the school systems, it's not quite the explosive situation like we have in other populations. The bigger issue, and I think you can all imagine it, is how do you start? If you look at an example of a university, I know that you're dealing with this at your university, I'm dealing with it at mine. We want to start with what we consider a clean slate. We'd like everyone to quarantine in the week before or 2 weeks before. We'd like people, ideally, if the resources were there, to have testing so that we know we're starting with what we could consider a clean slate. And that's not that easy to do if you're talking about the entire school population of this country. So, I think it was on this talk 2 months ago when we started this. I was in favor of universities. I was very much in favor of universities trying to open for in-person care, because I felt like universities had a better chance of having the resources to basically cohort people. It's a large cohort. We've all heard about cohorts these days. But to think about basically creating a cohort of a reasonably healthy subpopulation and saying, okay, we're going to quarantine, test, and really watch this group. I thought that was a potentially reasonable way to sort of divide up our populations in this country, at least from the university standpoint. And it turns out to be quite difficult. And universities have more resources in general than public school systems do. And we're dealing in general with smaller population sizes. And even still, universities are mostly turning towards either a hybrid model or a completely online model. So it's a little bit, it's a little bit disappointing because it seems doable, but it's just in practice quite challenging.
Absolutely. Thank you so much for answering that. Our next question is aimed at you, Seth, and this is, since the federal government has done so little, the states to some extent have had to kind of be on their own in coping with this virus. Do you think for the future, this is going to give a rise to a greater role for the states in managing disasters, or a rise in federalism more generally?
That's a great question. I think for me, one of the surprises of this whole thing is how little a role the federal government has played so far. And I sort of thought, the lesson that you don't want states tinkering with a national level problem without really federal backup. I sort of thought we already knew that, that we'd figured that out a long time ago. I think the last time we did this talk, I brought up the example of the Mississippi River flood of 1927, where there were just sort of a lot of local solutions to a very big interstate problem. And one of the lessons coming out of that was, really only the federal government has the capability to do this, to coordinate all the resources. It has the financial resources to make relief happen and to prevent some of these problems in the first place. We seem to have scaled back somewhat from that. I don't know if we're in an era where the federal government would always act this way. I don't know how much of this is just simply a function of which party controls the White House, or just this individual who is currently in the White House now. There's a lot of different things at play. my impression is that one of the lessons coming out of this era, particularly when comparing the US response to a lot of other countries' responses, which have all looked quite a bit better, near as I can tell, is that there's really no substitute for a national response to a national problem. And you generally don't want to find yourself in a situation where governors are all putting together their own task forces and each responding to their own set of political incentives, and coming up with their own answers, because of course the virus doesn't necessarily follow state lines, we're in a very polarized partisan era. There's good and bad associated with that, but generally you don't want to respond to a national level crisis, particularly a pandemic, that way, because how you respond to a crisis actually affects how other people experience it. So I tend to think coming out of this, particularly if the election ends up where it seems to be trending, is that you'll probably have more of an era of support for federal action. This will be seen as somewhat of a failure of, the inaction at the federal level will be seen as something of a failure, and we'll probably have kind of a renewed level of support for national level responses to problems.
Can I follow that up, Seth? One of the things that I've noticed just geographically is that we look a lot like Europe, except with a lot more wide open borders. We're a bunch of states with these boundaries that really almost mean nothing. And while one area might do well, like early on, the Bay Area where I'm living was notorious for doing well, whereas other areas had more infections, and some areas didn't even know what the situation was. With such wide open boundaries, yet this notion that we are these separate states that have all these rights, is it a viable way to treat this, to close all the state boundaries, or at least make more restrictions on travel? And two, is there any precedent towards closing these boundaries a little bit more?
Yeah, you know what? That's something I should look up. I honestly don't know much of the history on closing state boundaries. I mean, generally, there's an interstate commerce clause within the Constitution, and limits on people's ability to cross over state borders are there's a really high threshold for being able to do that. I remember living in California. If you were to drive out of the state and come back in, you would have these inspection points. I don't know if those inspection points still exist, but where they would check to see if you were carrying any fruit that might be carrying some sort of a bug or something like that might be dangerous to the state's crops or something like that. So in some circumstances you can have, places where the state has an interest in protecting an industry or protecting a population, and just sort of not really preventing interstate travel, but at least, limiting it and regulating it in some way. With an enormous state like California, I sort of wonder how much of a difference that would make, where you've got 40 million people living in a state. Even if you can only travel within that state, that's still a huge amount of travel going on. On the other hand, in like the East Coast states, where you have people who regularly cross state lines just to get to work or school, that would present a real burden. Maybe it's possible to do that. Maybe it's possible to just have inspection spots. And I'm not really familiar with the legal history on this. But just to simply have, to say, if you're in DC, do you want to cross into Maryland today? Fine, we have to take your temperature first. Maybe. That might be something that would help. Or, there might actually be possibly even just complete shutting down of state borders might be a possibility for dealing with this sort of thing. But, the way we've been treating this is basically open borders across states. And this virus can spread pretty freely right now.
Maybe we just need 12 districts, like District 12. I mean,
we should write a book on that. That's a good idea.
It's a good idea. It's a good idea.
Okay, Maddie.
So our next two questions, one for each of you, of course, kind of have to do with things we've heard about in the news cycle lately. So Harris, we're going to start with you. Could you tell us a little bit of the latest science and things concerning hydroxychloroquine? I think I pronounced that right. Very hard word. There's been a lot of back and forth on whether it's useful in preventing COVID-19. Some say it's not useful at all. Could you give us a little more information there?
I hope that I never have to say this word again, but Maddie, you said it really well. Hydroxychloroquine, terrific. It's become the bane of the medical world's existence that we keep talking about it, and we all think we know why we're talking about it because it's been politicized. There is not a lot of evidence to actually. There is a lot of evidence. There's not a lot of evidence to support its use. There is evidence to not support its use. So. Please don't use it. And please don't use it as a preventative drug or to treat. It's just not, it's not something that we're using right now. And there's been a lot of evidence on, in one study or another. I just recently, I wish I could cite it. I think it was one of the groups that I connect with, just summarized everything sort of perfectly. I think 6 terrific studies saying, can we move on now, please? Basically showing that these 6 studies really showed that this is not, it's not been useful. Now, it is a wonderful drug for other uses, but not COVID-19. So, but it's really another interesting piece here of how something gets politicized. This is a treatment that became politicized, and so people started buying it up in quantities. I think not only because they thought it was going to be helpful to treat or prevent the illness, but also because they thought it might be, to their economic advantage to own it. But it's turned out to not be that useful a treatment. And there are useful treatments that are out there, and we are learning more and more about not only in-hospital treatments, but we're starting to learn more about outside of the hospital treatments for people who have mild illness to prevent further illness. So that's some of the exciting research that I'm really following these days. But to put a nail in the coffin, not so much with hydroxychloroquine.
Wonderful. Thank you so much. Now, for you, Seth, will you tell us a little bit more about vote by mail? Of course, here in Colorado, we've had it for a while, but it's come under scrutiny by some on whether it's effective, whether it encourages fraud. Could you just give us a little more information there?
Sure. Thanks for that one, Maddie. But just real quick, I'm noticing, just have the chat window open here. I'm noticing a few questions are popping up in there. Again, if you have a question for us, please post it in the Q&A thing at the bottom of your screen. Just want to make sure we get a chance to hear all your questions. Okay, vote by mail. So yeah, in Colorado, we've had vote by mail, I think since 2013. A few states have had it longer. Oregon has had it, I believe, since the late 90s. There's a number of other states that have been practicing it pretty regularly. Basically, it's proven. It works very well. Now, absent a virus, there might be some reasons to not want to do vote by mail. There is the idea that actually having an election day where it is simply one day and people all get excited about participating on that one day and people stand in line and it's a social thing. And there is actually some positive value to that. But, given the environment that we're in, vote by mail honestly makes a ton of sense. And even when we've done vote by mail outside of a pandemic, it actually works quite well. There's some recent political science studies on it suggesting it modestly increases voter turnout. So voter turnout goes up slightly. It goes up for both parties. So this is not just something that helps Democrats or just helps Republicans. The differences between the parties are negligible there. So it helps with voter turnout. It's very convenient and it's very safe. Now, it does rely on a working U.S. Postal Service. Which it seems to be now, but yes, there's been some concerns raised about the Postal Service. And it actually does cost, in some states, you have to pay, including Colorado, you have to pay for the postage. It's additional postage to mail it in. It's basically 2 regular first-class stamps. If at all possible, I always recommend if you receive a ballot at home to actually drop it off at a place where they have ballot drop-offs. Usually there's a lot of them around the city. There's one just a few blocks from my house. That's typically how I vote. But you have, a nice window to actually make a voting decision. Here in Colorado, ballots will go out in early October. We'll have several weeks with the ballot sitting in the house, and then as long as you drop it off before Election Day, it's great. It gets counted. President Trump has really tried to raise a lot of concerns about vote by mail lately, suggesting it is inherently fraudulent. I just want to be as clear as possible about this. That's not true. Vote by mail is not more prone to fraud. In fact, fraud is very, very rare. Fraud is very rare in general in American elections, but particularly so in vote by mail. Just the opportunity to commit fraud is actually very low. It's very hard to pull off. Yes, a lot of people can request absentee ballots or vote by mail ballots, but in order to actually obtain one, you need to have a signature on file. They check your identity. It's actually a very difficult system to thwart, and voter fraud rates are really very low. This is really a safe way to vote. There is one, one particular wrinkle with widespread voting by mail is that it takes longer to count the ballots. And we're likely to see a lot of that this year. A lot of states, even that don't have formal vote by mail the way Colorado does, a lot of places are ramping up their absentee balloting systems. A lot more people are requesting absentee ballots than usual just because they don't want to stand in line for justifiable reasons. And that means it's simply going to take longer to count all these votes. That's fine. It can take a while to count things. But I think we should go into election night not necessarily expecting that we're going to know the answers that night. If there's if one presidential candidate is ahead by enough, yes, we'll probably know fairly soon at the turnout on that. It's possible it'll be a much closer election and we just won't know for several days or even several weeks who won. It's possible we won't know the results of a number of congressional and Senate and gubernatorial races. And that is okay. In 2000, there was a lot of late counting and figuring out who exactly won the state of Florida and thus who won the presidential election. It wasn't until December that we knew that George W. Bush had defeated Al Gore. For all the problems with the counting that year, the fact that it took a while to figure out was something we could handle. It was annoying. It created a lot of weird news stories. It was frustrating. But the Republicans survived that sort of thing. So I would just, I would encourage people to expect that this will take a while to sort itself out, but that there's time for, for the counting to be done accurately, for the Electoral College to reach its decision, and for a president to be inaugurated on January 20th as normal. Sorry, long answer.
Awesome answers on both parts. So up next we have vaccines. So this is kind of a long question. So first step, do American people need to be concerned about the rapid rate that a vaccine might be developed and how effective it could be and some missed side effects that can come up with that? And then additionally, what are some, do you anticipate what the motivation and or political effect of a vaccine being created late in the election cycle? Sorry about that, tripped over my words.
Is this me?
It's both.
Okay.
Two parts, kind of a medical side and a political side.
Yeah, there's clearly a political and there's probably an economic side to this. We should have an economist next time as well, because the economics of the vaccine production is clearly a big piece. I'll speak to the medical side of vaccines. They do a lot to make sure vaccines are safe. And I think that even though they're going as quickly as possible, the reason they're going slowly, I guess, in some people's perspectives, is because they really have to make sure that we are safe. And they've gone through phase 1 and 2, and now we're entering to phase 3 trials with a number of different vaccines. They're promising, and I've been hopeful about the side effect profile. So far, I haven't seen anything that's really concerning. There is this possible concern that everyone is really a little bit worried about with this possibility of a vaccine sort of creating this augmentation of your immune response and actually making you sicker if you are re-exposed to this infection. And we've seen that with an attempt to make a dengue virus vaccine. We're hoping we don't see that. So far, we have not. There are a number of different vaccine types and different mechanisms that we're employing to create these vaccines. So far, I haven't seen anything that makes me concerned about the safety. What I am concerned about is our appreciation of the safety, because we already know that there are a lot of people in this country who who are concerned about the safety of the vaccines that we have, yet the vaccines seem to be quite safe. So it seems like one of the things that we're dealing with is that the concern about the safety of the vaccine doesn't quite meet the actual safety of the vaccine. So with this pandemic and with all of the medical misinformation that's been out there, it makes me wonder how we will tolerate the vaccine in terms of tolerate just the interest in the vaccine. Will people even politicize the vaccine? Will one side of the aisle say that the vaccine is not something we should take because of one reason that I almost can't even imagine? So, but in terms of the safety, I'm happy so far with what we're seeing.
So,
Seth, over to you.
Yeah, this is an area where I have a lot of worries. I'm actually, I've been working on a piece with an old friend, Jennifer Reich, who's a sociologist at the University of Colorado, Denver, on this topic. She does a lot of work on vaccines and why people resist them. So as I understand it, and as I understand the science on this, you know, if we were to actually have a vaccine roll out basically within the same year that the virus emerged, that would be a world record. That usually these things take several years at least to figure out, if at all. And, you know, basically because, you know, virology doesn't necessarily work on a political timeline. You can say you want to have a vaccine by November. That doesn't mean it will automatically happen. And as I understand it, they have come up with ways to try and streamline this process. A lot of processes that usually occur sequentially, so they will like look at the data from the last process before they go on to the next one. They're trying to do things simultaneously to speed up the process. Hopefully that still works. Like you say, Harris, you know, we haven't seen any major safety issues with this, but it's possible this could happen. I think it. I think there's some chance we could see the president simply announce, "Oh, by the way, there's a vaccine now," and much as he has with hydroxychloroquine, and say, "You know, I encourage you to get it." And then what happens? I think, you know, then you have sort of a real test of the rest of the government. Do people in the FDA say, yes, we're okay with what the president says, or no, this has not been thoroughly tested yet? What does, you know, what do other aspects of the government say? Do other party leaders kind of split along party lines? In some ways, I think like the biggest test will be for the media. You know, if you end up seeing news stories like, is this vaccine safe and effective? Experts disagree. That's a bad story. You don't want to read that. You know, this is an area where in order to have a successful vaccine, basically, you need a lot of things to work right. You need a lot of different governments, state, federal, local governments to partner together on this. You need public and private sector and research and academia communities to work together on this. And if people are going to take it in widespread numbers enough that it's effective, people have to trust the government. People have to trust this serum that they're getting injected into their body, even when they're not feeling sick. That's actually a fairly high bar. And so, you know, when you have if the process looks politicized and it looks partisan, that really undermines it. And it also will make it harder for future vaccines to get administered. So I have some real worries here about this.
Yeah, I do too. And one interesting thing, and we all love hypocrisy, like it's just really exciting. It seems like some of our elected officials have really resisted in enforcing mask rules because that infringes on somebody's personal liberty to not have to wear a mask. But I would suspect that some people who feel that way would also insist on people getting a vaccine so that they can go back to the lifestyle that they want. And I think that would be a nice moment of hypocrisy where you can force somebody to get a vaccine that they may not want to get, whereas you wouldn't force them to wear a mask. I also can imagine a lot of people saying, listen, I was fine to stay at home during the first part of the pandemic. I don't need a vaccine. I'll stay at home and wait till this thing goes away and wait till there's enough herd immunity. And this will be an interesting moment in a year, 2 years, whenever it happens, of personal liberty versus, you know, as Spock said, the needs of the many outweighing the needs of the few.
Or the one.
Good
Good
job.
quote.
Wonderful. And going off of that, we have kind of a follow-up question, because you both mentioned kind of how the US is very individualistic. So do you think politically, if it's mandated, they've tried mandating mask wearing and social distancing and these things, if they tried to mandate a vaccine, do you think enough people would actually follow to make this work to encourage the stop of the virus?
I mean, I guess, well, partially there's a question built in there for you, Harris, is like what percentage of the population needs to take a vaccine for it to help the whole population? I've heard somewhere like 20 or 30% to maybe it's 70%. And I guess maybe we don't even know with this particular virus yet.
So the answer is, the standard answer is 60 to 70% for herd immunity, but there have been some terrific, there was a study, if you look back at some of my older talks that you cited at the beginning on the Bay Area Disc Facebook page, there was a great study that talked about how super spreaders, meaning individuals, people who actually go out and are much more social, or people who are essential workers who are around everybody, those people are the ones who need to be immune. And if you had a lot of super spreaders getting vaccines, then you only maybe need 40%, and for 40% immunity in a population for herd immunity. I mean, basically, you've got to keep the people who are sick, who are connecting everyone, the ones who are connecting the dots, from being able to connect those dots. And the more your population is immune, the less a virus will find a hold and go to the next person. So the 60 to 70% is based on some modeling that's been done and repeated. I would say that what really matters here, though, is the effectiveness of the vaccine, because there are some ideas that this vaccine might be effective for only a handful of months, like the flu vaccine. Every year we get a flu vaccine because the flu changes to some degree, the antigens on the little bug changes, and the types change. So we need to get a different smattering of things to stimulate our immune system. That might happen with this vaccine. We might need to get a vaccine every X number of months. So herd immunity might be challenging. It might not be like we think about it with measles, mumps, rubella, where if everyone gets immune, we pretty much knocked this thing out. 98% of us have had the shot or something like that. This might be something where it's a rolling series of vaccines given to keep us relatively safe.
I guess one of the related complication, one of the ways we enforce pretty widespread vaccine use is by kind of insisting on it for kids. That either they get it when they're born, or in order to attend a public school, they have to get a series of vaccinations. For COVID, it's not, this isn't necessarily a kid's virus, right? I mean, that I'm just guessing here, but like, even if you enforced all that, it might not have the effect when you're trying to protect the elderly for the most part, or the near, whatever our age group is, the near elderly, the Gen Xers. That enforcing that is, I guess, a little trickier. I don't know what means they have to actually force people in our position, or people who are not yet in nursing homes, to go out and get a virus, other than actually, like, if there's a financial penalty for not doing it, which would be fascinating, but I don't know. That sounds like something that's really tough to enforce.
Yeah, you're right that this is not the vaccine like the kinds we talked about with the measles, mumps, rubella that offers lifelong immunity. I mean, we don't know yet, right? But we're not looking at get one shot at this stage. Now, in 5 years, this might be one of the routine ones that everyone gets when we figured out the technology, and everyone gets when they're 3 months old, 6 months old, and 12 months old, and they're done. They never get this coronavirus. But for the initial phase where everyone needs to get vaccinated, it's obviously a different rollout.
Wonderful. Thank you for answering that.
Sure.
So we're running short on time, but I think we have one last question for each of you. So to start, Harris, so California medical schools have excused the class of 2024 applicants from submitting their MCAT scores. Do you believe the implementations of remote learning, like taking online courses for lab classes such as organic chemistry and physics, are going to influence how medical school students are admitted in if class learning doesn't resume soon?
That's a great question. Whoever asked that, I want to thank you for asking it, because I have not had that question in any of these different panels I've done. So I think, and this is also, I think, an overlap question for Seth, because he's involved in teaching on the university level. Obviously, remote learning is going to significantly affect the way people learn, and there are certain types of learning, like laboratory learning, that are just much more difficult. I work at a huge research institution, and one of the biggest things we're trying to get people safely back in to do is work in the labs, because there are things you cannot do via this medium that we're on, a Zoom chat. It just doesn't quite work the same. So I expect that this will significantly impact our ability to train, and I also expect that, you know, we don't know how long this is going to go on. So we're going to have to come up with ways for people to learn what they can, so that we can continue to keep the workforce learning. You know, I think it's a really fortunate thing right now to be able to, be, you know, in education and not actually be hitting the job market. But if the education is limited, that's a significant impact. So I hope I answered the question, but you know, I think we're going to have to continue to pivot in order for people to get further in their educational processes. Seth, how would you add to that, since you're involved in this as well?
I don't know. You know, I was actually thinking about, and unfortunately I can't remember who wrote it, but I read a piece just this morning suggesting that in some ways we're asking the wrong people to go online. That there have been a lot of universities that are working very hard to reopen in person, and meanwhile we're shutting down elementary schools and middle schools and telling those kids to do all their learning online. In some ways, college kids can probably handle the online environment a lot better. They can do a lot more independent work on their own. You know, it's a bit more of a mental lift, and they're probably better equipped for it. Whereas kids, it's probably safer for them to meet in person, and it's probably a better learning environment for them. Maddie, you were just in a class of mine this last spring that was conducted entirely online, fairly last minute. You did great. And it was honestly like, my preference would always be to teach in person. I think it's an overall more satisfying experience for everyone, but teaching online is not horrible. It can be done well, but you know, Harris, you're absolutely right. There's some things that just don't work that well for this medium. Obviously certain aspects involving labs are one of those. Theater is going to be difficult. Dance, you know, all sorts of things that are just very difficult to pull off over a Zoom chat. But I think we're going to get a lot more creative about that over the course of the next year, for better or worse.
Yeah, we're learning.
Yeah. Sorry, Maddie, what was your other question?
So the last question that I think we have time for is about postponing the election. Do you think that's a possibility? Are we going to see polling places close? What do you think this looks like?
You stole my facepalm. No, we will not postpone the election. Okay, first of all, we don't do that. We have not done that in this country. We have never postponed a presidential election. We held a presidential election during the Civil War in 1864, when a bunch of states were fighting other states. You know, we've held them during other pandemics, during other wars. And, you know, given what we talked about earlier with vote by mail, we have the technology. We have a good solution for conducting this vote in person, or conducting this vote on time. You know, President Trump sort of floated this idea last week of, hey, maybe we should postpone things a little bit until it's safe. That's a terrible idea. That's a terrible idea to float. Basically, it's as hopefully someone has informed him, that is a very authoritarian thing to do. I mean, that is something that dictators do in other countries, and just sort of decide, well, we'll have an election when I feel like having one. that is a real danger for any functional democracy. It's something we've not done in this country. There are a handful of local elections that have actually been delayed in circumstances when it was functionally impossible to have an election. So for example, on 9/11 in New York City, there was actually a mayoral election going on that day. And that was postponed by a few weeks at the last minute when the attacks happened. But apart from that and one or two hurricanes, we really haven't done that. And we certainly haven't done that at the national level. If for some reason the federal government decides, okay, we need to postpone the election, first of all, the president can't decide that. The FEC doesn't decide that. That is a decision made by Congress. So majorities of both the House and the Senate would need to agree on a new date for the election. I think it's very unlikely that you would have the Republican-controlled Senate and the Democratic-controlled House agreeing on something like that. And then you still have these constitutional requirements. You have the Electoral College that meets in December. You have the president's term ending on January 20th. If no new president has been selected, then Donald Trump's term expires, and with no president and no vice president, Nancy Pelosi, as the sitting Speaker of the House, would become the new president of the United States. That's probably not an outcome he wants. So there's all sorts of reasons why that wouldn't happen, but really, honestly, it's a very dangerous idea to float. It is because if he ends up losing the election, he just says, well, I would have won had that election been fair, had it been held on a fair date. And then that's all sorts of reasons to try and delegitimize the results of the election. And it's basically not the sort of thing a functional democracy really entertains. Sorry, does that help? Did that answer the question?
Do you feel strongly about this? I'm just checking.
Let me check my pulse here. I don't know. I'm a scholar. I don't get riled by stuff.
Sure.
Great. Okay. Are we good, or do we have time for one more?
That is up to you guys. We could definitely ask one more.
What do you think, Harris? Can you do one more?
Well, I had a question for you that I think you know.
Okay.
I am kind of wondering, how is this pandemic different from the pandemic you expected? And how is it similar to the pandemic you expected?
So that's a really interesting question, and I'm going to actually want to ask you the same thing. But I guess a lot of the pandemic I expected comes out of sci-fi, other books and movies. So and generally those lead us to expect it to be a lot deadlier, with much higher mortality rates over a much shorter period of time. But also, just generally speaking, we've had other pandemics during our lifetime. There was SARS, H1N1, and swine flu in the 70s.
Zika.
Yeah. And one of the things Ebola, one of the things I have grown to expect is that whatever happens, it'll be less bad in the United States. Simply because, we have a pretty good infrastructure for these things. We have money. We have resources to throw at the problem. And just sort of a history of, yes, being very individualistic, and states can do what they want, but in times of crisis, we tend to pull together and figure stuff out. That really hasn't happened this time around. So I've been surprised that that the response has trickled on as long as it has, and as that sort of relief from it has proven so elusive for us, and that it's proven so divisive, honestly. I mean, I guess, sure, anything can become partisan today, but I still am kind of surprised how split responses to this are, and really how much, not just that, okay, it hit the US as bad as everyone else, but it seems to have hit us a lot worse. And that's really something I would not have seen coming. Anyway, let me flip that back to you. How is this different from the pandemic of your dreams?
Well, the pandemic I expected had more zombies. I'll just be honest. More zombies, but outside of
fast or slow zombies, which
fast zombies, and that was the one I was really worried about. No, I think the pandemic I expected was more in the model, and I blame myself a little bit. I think all of us who who do this kind of work are always kicking ourselves a little for what we missed. We tend to be pessimistic, dressed as optimism, but so I'm surprised with all of my pessimism that I missed this nightmare scenario. And what I mean by nightmare scenario is I expected a much more deadly wave, much like the pandemic, the second wave of the 100-year ago pandemic, where incredible mortality. And because maybe my pessimism led in that direction, you imagine that there's an incredible rallying cry, like you're talking about, that we don't have, because it's a life or death situation for everybody. And what unfortunately we have is a virus that almost has enough people in this country convinced that it's like the flu that people want to ignore it. And I think the fact that it has more long-term problems than we expected, and more subtle issues. I mean, I think for the first 3 months, there were people who have, these COVID toes, for example, and they don't even know that they had COVID, but they just happen to have purple toes for a few months. I have colleagues and friends who have had pain in their legs since that time, and they still don't have a diagnosis of COVID. So the fact that this is such a smoldering and difficult infection that is so easy to spread, but is only mild, it's only about 10 times or maybe 20 times deadlier than a bad flu, is frustrating, because it has kept this country from really rallying together. Maybe it's part of what's kept the country from rallying together. And so I really expected a huge wave, and then we would figure it out. And instead, we have a smoldering fire. And I didn't anticipate that whatever happened was going to rely on political acumen and everyone rallying and a vaccine. That's a tragic scenario for this country right now. So in some ways, one really smart person I read early on said, this virus evolved for us. We spent millions of years evolving to this, and it spent a few months evolving, saying, yeah, this is how you act, we got this. And it's a little bit of a bummer that way. That's my answer. I mean, more than a little bit of a bummer.
Yeah, a little bit of a bummer.
A little bit of a bummer. That's the headline. I'll let you wrap up.
Okay. All right. I think we will wrap it up at this point. I really want to thank everyone who joined us today and who chimed in with your questions. I'm sorry we didn't get to all of your questions. You should feel free to email us. I think we'll be doing a little follow-up for those of us, all of you who RSVP'd to this, just to make sure you have information about some future events. I want to thank Aaron Dietrich here at University of Denver for helping to coordinate this. This has really worked well, and thank you for doing that. And really special thank you to Maddie. Maddie Alder, thank you so much for your help today with just steering all these questions. We really appreciate it.
Thanks for inviting me to join. It was super fun.
Sure. And as always, Harris, thank you for joining in and lending us your expertise for the day. We truly appreciate it.
It's my pleasure. Thank you. And I see that you see a diploma behind you. So go Bears.
Yep. There we go. Okay. All right, everyone. Have a good day. Take care and stay safe.